Are you looking to expand your aesthetic practice and attract high-quality new patients? Discover the power of digital marketing in growing your practice with a personalized strategy session. Join Ryan Davies, Equa's Marketing Director, for an exclusive 90-minute meeting. Ryan and his team will invest hours prior to your session, crafting a customized marketing plan tailored specifically for your practice. This invaluable opportunity comes at no cost to you, with no commitments attached. Schedule your meeting with Ryan today by visiting www.businessofesthetics.org/MSM and take the first step towards transforming your practice with the potential of digital marketing.
You're invited to join our exclusive monthly webinar brought to you by the Business of Aesthetics community. Don't let this chance slip through your fingers. Secure your spot now for a game-changing experience. Register for free on our homepage at www.businessofesthetics.org and get set to transform your strategies.
You are listening to another episode of the Business of Aesthetic podcast series, brought to you by our gold sponsors, MRP and Equa Marketing. We also want to thank our silver sponsors, Pronox and Lengea Law. If you would like to network and share your experience with our podcast guests and other aesthetic industry professionals, join our Facebook or LinkedIn communities by searching for Business of Aesthetics. Get ready for an insightful conversation as we connect with a true luminary in the world of aesthetics. Our host today is none other than Naren Arulrajah, a seasoned serial entrepreneur boasting 16 years of invaluable experience in aesthetic marketing. Naren's passion has driven him to co-found the Business of Aesthetics community, and we're privileged to have his expertise enrich our discussion today. Over to you, Naren.
The topic we're going to be covering today is grow your aesthetic practice with male patients. And I'm hopefully you don't mind me calling you all by your first name. So like Richard said, it's male dominated. We have 4 panelists. I am going to be the host, and the panelists are going to be Richard, Jordan, Loretta, and Ryan. So I'm going to go around the room and I'm going to ask each of the panelists questions. And these were questions that were submitted by you, the audience. Hopefully you all learn from this because it's your questions we are answering. And my first question is going to be like asking the panelists to introduce themselves, tell us a little bit about themselves, so you all know who they are, where they're coming from, and what perspectives they bring to the table. So let me start with Richard, Dr. Richard Moore. He's an MD, and he's the director and owner of the Lifestyle Center and the Edge for Men. My question to you is, tell me a little bit about your 2 practices. What motivated you to start a separate clinic for men? And what do you think are the top areas of concerns men have? And are the services that your practice provide for male patients? And what are the services that your practice provides to male patients to address those concerns? So it's a long-winded question, but so just tell me a little bit about yourself, why you got into this, especially the male, like a dedicated clinic for males, and what are the needs that you're meeting?
So the Lifestyle Center was first opened in 2003, and our original focus was more on wellness. And I think we were a little bit ahead of our time then, and it didn't do so well. So we quickly switched our focus to aesthetics. And in 2017, the space immediately adjacent opened up to us. And I debated moving my liposuction over there versus something else. And I was out for a walk and came up with the idea of, let's put a male clinic next door. And our focus there is more on sexual wellness. So we do hormone optimization. We do things like the P-shot, male enhancement, erectile dysfunction. Anybody that's a part of our testosterone program it's almost considered like a membership. And they get a discount for services over at the Lifestyle Center. So it's a way to bridge people from the male side of things over into the aesthetic side of things. And that's worked fairly well. What we did learn is that the men that come in for their injections for testosterone are much more likely to do services with us. Most of them do not come in for their injections. And so as we looked at things like weight loss and things like that, that became more of a consideration as well.
So looking back, do you think it was a smart move creating this male clinic? What do you think is the void in the marketplace that you think having a male-only clinic is able to go after and tap into?
Well, if part of the reason I did it, at the time I was about 60 years old. So those are concerns that are current to myself. And so it gives you a lot of credibility with people. But it was a good decision in that it brought new revenue streams into the center, which have very good margins, and allowed us to take the services that we had at the Lifestyle Center and cross-promote those. So as an example, if you have a patient on M-Sculpt or M-Sculpt Neo, and you offer testosterone, or you have a patient on testosterone, you offer M-Sculpt or M-Sculpt Neo, it's a great fit together. And as we've brought our weight loss program in, it's been a great fit in there as well. And so having that separate space where men feel safe in the sexual world is important, I think. Mixing people together where you're talking about male enhancement and things like that, and ED, with women sitting in the lobby, I don't think goes over as well.
Fair enough. Thank you. Jordan, again, similar question. Tell us a bit about yourself, about your practice, what type of services do you offer? And also, another question I have from the audience is many men are concerned about looking unnatural after treatment. Can you discuss how you approach achieving subtle enhancements and natural looking results for your male patients?
Yeah, absolutely. Thank you. So I have 2 locations, one in Virginia, one in right outside of Scottsdale, Arizona, and then a third location that is not as aesthetic based. It's more like Dr. Moore mentioned, it's a wellness and optimization clinic. We specialize in both male and female. But I would say I agree with everything Dr. Moore had said. We kind of found a similar situation. And I wanted to real quick before I answer that question, kind of piggyback off of him in that one of the ways I really started getting men into the clinic, believe it or not, was through their wives, their spouses, or their significant others, by letting them know that there are services that we offer. Whether that's, we just bring it up in casual conversation, whether it's on the TV role that's playing in each one of our treatment rooms. I can't tell you how many of my patients actually got, I call it drug in by their wives saying, hey, let's look into this. Let's do this together. And so that was really how we started marketing it, and it went really well. And then what I did is I found certain people locally that I hate to use the word are influencers, but I reached out to a well-known bodybuilder in the area that I treated his wife and offered basically some highly discounted services to use before and afters, and kind of a collaboration because I knew he was very much intertwined with a lot of men in the area. And that really paid huge dividends. And what I did is I used his before and afters, and since have accumulated many that I've put into a binder that my men can actually flip through and see before and afters. And a lot of times that alleviates that concern of not looking natural. Because when we treat, as everyone on this panel knows, we treat men very differently than women when it comes to aesthetics, from the facial features, to the contours, to how we inject them, to the products we use on them, all play a really key role in making sure that they maintain a masculine feature, and that we're not feminizing them. And I think I could go really in depth with product selection and how we're using it, but the biggest thing for keeping the natural appearance, in my opinion, is understanding the differences in the male and female anatomy, and how when you augment one area, for example, of the face, making sure that we're harmonizing above and below that area so that they're not looking out of proportion or out of harmony with the other facial features.
So Dr. Richard Moore kind of said, okay, I'm going to have a clinic for men. You didn't do that, right? So what are the pros and cons of your strategy? Are there any cons even, like, or even pros?
You know, I honestly, I've been very fortunate to where I have a very large male clientele. In fact, preparing for this talk, I went back and pulled data, and about 22% of my clients are men in the aesthetic side, which when I was looking, I did just pull a recent PubMed article that was showing that in 2018, only 10% of the aesthetic patients were men. And so I have been very fortunate in that regard. But I think it's also how we communicate to our men. One of the analogies that I like to use, because it really clicks with most men, is I use a car analogy, right? If you get a Rolls Royce, you get a Ferrari, what are the first things you're going to do? You're going to make sure that you wrap it in PPF to protect it. You're going to wax it every month. You're going to detail it. You're going to clean it. Well, we get one face, we get one body. Why would we not do the same? And the ladies have been ahead of us. And I tell them, it's like, look, if you want your wife when she's 60 looking 40, do you want to be looking 70 and 80? I don't think so. And so I think it's all in that initial consultation, breaking down the barriers, discussing how it's not abnormal that we're seeing more and more men do this. I've seen the taboo of aesthetics, luckily, thank goodness, start to fade in general. But I feel like the men are still holding on to some of that worse than anyone else. And so if we can really break through that, calm their anxiety about looking abnormal, show them before and afters, discuss our plan, how we're going to do it step by step, very slowly. It's not a wham, bam, thank you, ma'am. It's going to be a very natural progression. I've had a lot of great success with that. We did not decide to split them up separately. And to be totally transparent, in the beginning, it was just for overhead. So we actually ran it out of the same clinic and just divided the two sections off. It's been great. I have not really had any issues. I mean, I do have ladies waiting in the lobby for their tox appointment, and there's a male next and waiting in the lobby for male enhancement, and I think it also goes into training the front desk staff. We're very, I would say, quiet and very selective on the wording we use. Obviously, we're not checking someone in and saying, "Hi, Mr. So-and-so, are you here for your penile enhancement?" We keep it very HIPAA compliant, very low key and discreet for them, and we make sure they're comfortable from the time they walk in to the time they leave.
So even the people providing care, do you have men taking care of men, or it doesn't seem to make a difference?
No. So what I found is that I have several providers from MD to PA to NPs, and what I like to do for my men is I will be kind of the initial consult, and then I will actually bring in one of our other providers to assist me with a lot of these procedures. And that really helps break the ice. I let them know they're assisting me. Sometimes I think you have to make light of it. We'll kind of joke around like, hey, she has seen more of these than you would ever imagine. It's totally fine. And it's honestly, in the beginning, when I first started offering it, I was concerned that it might be weird, it might be awkward. But really quickly, I realized that if you can make them comfortable and make them realize that they're not some minority, that there's so many men out there that are doing the same thing, they're wanting the same thing, they really are comfortable. I haven't had any issue, knock on wood, to date with anyone saying they felt uncomfortable or they backed out of something just purely out of nervousness. And all of that, I think, comes down to a really good consult, setting the expectations and educating them ahead of the appointment on what to expect.
Thank you, Jordan.
Sure.
Loretta, I'm going to turn to you, and I have kind of a similar question. Tell us a bit about yourself. Tell us a bit about your practice. And I do have a question from one of our audience members. How have you gone about creating a welcoming environment for male patients at your practice? Did you have to make any changes to decor in the way your staff handle things? And you being a female owner, again, has that created any kind of challenges or opportunities as far as male patients are concerned?
Yeah, well, thank you for having me on this on the webinar tonight. And I'm Loretta Zanetti out of Tampa, Florida. We actually started our practice in 2014 as a tattoo removal clinic, and that was the only thing that we offered when we opened. I actually didn't imagine that it was going to grow into the multi-service practice that we have today. But we started with a service that really was kind of male dominated, in the sense that you do have more men who have tattoos than women do. And then in general, the more tattoos you have, you're likely to not like at least one of them and attempt to get them removed. Over time, we kind of built our practice by adding on hair removal, because a lot of our patients were like, oh, you can remove tattoos with this laser. Can you remove hair as well? And you really can't. But that led us into the other services that we offered. And so we're about 35% male in our practice, and we offer different laser services along with the injectables, PDO threads, and body contouring. To answer your question about decor, I purposely, so we just moved into our new building. We were able to purchase some land and build from the ground up. And so all the things that I had learned over the last 10 years of what I liked about my previous location and what I wanted to change, I was able to incorporate into the new space. And I very mindfully made sure that it was an environment that was comfortable for all of our patients, including our male patients. And so as far as decor goes, we went for something that was timeless, that had some wood notes to it so that it was nice and warm, but also had some really nice, classy elements to it that the females would like as well. And so we stuck with like a white marble, a lot of white oak type of items, and we left out the pink and super shiny things, which I personally love. Like, I love all things that are blingy and shiny, but of course, it's not about me, it's about catering to our patients. And so those were the things that I made sure that I kept in mind. As far as being a female and taking care of men, I think that making anybody comfortable in your presence, it actually starts with yourself. You need to be comfortable taking care of people and not having that mindset of like being nervous and viewing them as someone who is different. People pick up on these type of vibes, much like dogs and babies. They've got this bullshit meter that they pick up on very quickly. And so, my years as a bedside nurse, I think has been very helpful for that. And we treat everybody pretty much the same. I've seen a huge increase in the number of male hair removal patients. And I'm getting a lot more men who just want to be completely hairless, basically from the neck down. They want to grow a full beard through here, but then hairless from the neck down. And I think really just treating it as a professional would in any other medical setting allows us to make people feel comfortable, get through the treatment very quickly and without any embarrassing mishaps.
Yeah, you had the privilege of listening to the other two, practice owners before you. Are there anything they said that you strongly agree with, or you might say, you know what, I do things differently? Just what's your take on your practice versus theirs?
I think in general, I agree with what everybody has said. I don't have a separate clinic for men or a separate space. And just like Jordan said, it's really because of overhead. And it just allows us to see everybody. And we do try to maintain patient confidentiality and not say or do embarrassing things. I don't offer hormone services or penile enhancements, but if I were going to, I would take the same approach.
Thank you. Ryan Davis is a marketing expert, so I'm going to have him, introduce himself, Ryan, just like everybody else. And I have a two-part question for you. One is from the audience, one is from me. The one from me is, anything you picked up on, like I know from a marketing perspective that you're like, yeah, this makes total sense from the conversation today. And then the second part of my question is, this came from one of our audience members, is like from a online standpoint, right? Online marketing standpoint, how do you create a welcoming environment for male patients?
Sure, absolutely. Well, thanks, Naren, for having me and being a part of this amazing panel tonight. I'm really excited to be here and share, my thoughts and insights, and maybe even more selfishly for me, pick up on the insider, information I'm getting here to be able to put into practice with the marketing efforts to help other practice owners be successful. But, I think, again, for a bit about myself, I'm a digital marketing advisor. This is the world that I live in. I specialize in aesthetics. And I really, I've been doing sales and marketing, especially for over 2 decades now. I've done everything from sales and marketing of aesthetics and other medical healthcare practices. I've run political campaigns, which nobody should ever hold against me. I've run my own political campaign, which was the worst experience of my life. All of those types of things. But I think that this is an incredible topic, obviously one that hits personally here in terms of, boy, I really like, this is impactful, as a male who, is, to everyone's point and to Jordan and Loretta's point, saying, this is kind of a little bit of bucking a trend, right? We've seen it in things like the push for mental health for men should be forefront and not in the background, and just general well-being for men should be in the forefront and the background. I think aesthetics, that's a big thing. And before I kind of get into that question, I wanted to just share a few thoughts here, kind of expanding on Jordan's point of, the American Society of Plastic Surgeons said that there was an overall 29% increase for male procedures from 2000 to 2020, 2 decades. Then they said from 2001 to the end of 2003, there was a 70% increase. So when you look at numbers like that, we see to that point of we've hit a tipping point.
And you mean from 2021 to 2023, right? I think
yes, correct.
Yeah. Okay.
Yeah. So we've hit a tipping point, right? And right now, this is a $1.1 billion market that is expected to hit $3.5 billion by 2030 in the same survey. So again, this is bucking that trend and being able to put yourself out there. And that's why I kind of wanted to lead into it that way a little bit with what are people doing and what makes that successful? How do you create that welcoming online presence? Again, to everyone's point, and Jordan specifically, I know, called it out as well. It begins with the consultation, but it even begins before that in terms of what can people expect? And if you're giving them the expectations and showing them what you do and making feel comfortable, when they walk into your practice for that consultation, the guard's already down. They're already prepared. They feel good about that. So some of the strategies I would say are incredibly important are things like use gender inclusive language. We're in a lot of sites that I'm seeing in a lot of online social media and things like that, there's still the she's and the hers and the things like that. Use more inclusive, welcoming language, avoid the assumptions that are going to alienate certain male patients and things along those lines. Really showcase what you do from a male perspective. So we're talking the before and after photos, have lots of, male patients that are willing to, be there as a testimonial, things along those lines. Put that on there and make it very easy and welcoming, from a psychology of influence side. And I know, Naren, Dr. Robert Cialdini is very close to your heart, obviously, as well. You want to have ethical influence for people in place. And when people see someone on a website that reminds them of themselves, they are much more welcoming and much more likely to convert into a patient. So if you've got someone where it's, again, I'm a very fair-skinned, ginger, middle-aged male, and if I see somebody else who kind of looks like me on a site, I'm going to feel like, hey, even psychologically, subconsciously, you can treat what I'm looking for. I feel better about that, right? So have a range of, again, you want to have men on there, you want to have their different skin tones and everything like that to make sure you've got a diverse representation from testimonials and images and materials before and after galleries. To everyone's point, educational content is super key, right? Tailor it to male patients, explain what they're looking for, common concerns, procedures. So it comes down to good original content on your website and your web pages that you're constantly keeping up to date with the newest trends and things along those lines. Understand, have a marketing company, or if you've got the time to do it yourself, or have part of your marketing team to understand what are people searching for in my area? What should I be showcasing that I'm not doing now so I can speak more granular We are a lazy, entitled society. We want information spoon-fed to us. So make it easy for people from that standpoint. And I know I said lots of testimonials and reviews, but especially off the start, ensure privacy and confidentiality. As Jordan said, watch your language, make sure you've got that. Emphasize any measures that are taken in that direction so that people feel comfortable. Clearly communicate, have your website that communicates the services, any specific accommodations, all of that, appointment scheduling, consultation processes, treatment options, all of that there. From obviously everyone on this panel, you know, professionalism, expertise, put it forefront, teach your staff what you need, have lots of great things. Again, videos of content. That's how we consume content, right? So make sure those are front and center on your site as well. Fully accessible site that, you know, so it doesn't matter for anybody who's regardless of ability or disability, easy navigation, clear contact information, clear call to action, all of that. Just make it easy, right? Like keep it simple, make it easy, show what you want people to see about you, what sets you apart, be engaged, and really tailor your online marketing efforts to resonate with the interests and preferences of male patients. Break down those barriers for them. Highlight the treatments, like I said, that are popular, you know, let them know what people are doing right now. If you're doing all of these things, you are going to have a very welcoming and inclusive site, and they're going to be compelled to call you and know that they can trust you, that their privacy is assured, that you are going to be able to give them a great educational based consultation and show them their path to their, you know, to reach their wellness goals that they're looking to achieve.
And I would add one more thing onto Ryan real quick if I can. And he may agree, but with marketing, what I found a huge return on investment for was a blog. I think blogs are huge for SEO optimization.
Yep.
And we did a blog that was entitled Bro Talks. And I cannot tell you how many hits we got within just a month. So it showed me people are searching for this. Men are out there wanting these services. Yep. You need to put yourself out there because if, like Ryan was saying, we know this is a huge industry and there's a ton of revenue to be had and it's an untapped market. And for those that can start marketing and really fine tune the marketing for male patients, I think they're going to be leaps and bounds ahead of others that aren't quite there yet.
Totally agree. That's a great call out. That's that original content. Keep it fresh, keep what people are looking for, know what people are doing, and give them that information at their fingertips. And if you have relevant, new, constant information on your site, Google's also going to rank you higher as a result. They're going to say, hey, great, this is Jordan's the foremost expert. Loretta's the expert in the area. Dr. Moore, that's who you need to go see here, right? Google recognizes that. And then you've got that huge influx of patients that are not costing you anything to bring in. They're organic patients that already trust you and have intent in the service that they want to have delivered to them. Great call out, Jordan. That's wonderful. Yeah, thanks.
Yeah, just to piggyback on what Jordan said and what Ryan said is, Jordan is absolutely right. There is a tool called Google Analytics, and you can use that to find out what people are literally doing, what keywords they're typing in, how many of them typed in what keyword, where do you show up, especially for free, right, through SEO. Are you showing up at the very top for free, or are you showing up at page 10 where nobody sees you? And then work smart. I mean, this is a lot of work, but there are 6 areas that are critical for SEO. And if you master all those 6 areas, this is the secret, dirty little secret. 5% of practices get 95% of the free traffic. So the question is, can you get into the top 5% who's going to get 95% of that free traffic? If you don't, then your option is, Google makes $237 billion from ads. At least that's how much money they made last year in a single year just from ads. You have to give them lots of money. If you don't want to give them lots of money, figure out how do you do the things that Google cares about so you get into the top 5% who's going to get 95% of the traffic. Anyways, as you probably guessed by now, I know a little bit about marketing. I'm also the founder of Equa. So yeah, I think all of you are right on the money. So do appreciate all of that. Let me go to Dr. Moore. So this is a question that was submitted by one of our audience. And the question is, pain management can be a concern for some men. Can you walk us through different options when it comes to pain management available for different services, and talk about how you emphasize or communicate how these pain management options are used to reduce discomfort or pain?
Pain management actually has not been a big concern with our patients. In some cases, I do use blocks, but most of the time I do not. We use a cold spray called Pain Ease when doing injectables rather than topical creams. It seems to provide greater numbing that is very short in duration. But we don't find pain to be a big barrier for us in general anymore. So, in fact, I would probably find more with women than I do with men. And so it's in the male field, I haven't found it to be a big barrier thus far.
Got it.
I think I have something to add to that,
Yeah.
since tattoo removal is probably one of the most uncomfortable things that you can endure in the aesthetic world, besides undergoing surgery. And so one of the advantages I think that I have as a female taking care of males is that, you know, men like to be babied a little bit. And so my most effective pain control technique is what I call talk aesthesia, you know, kind of talking people through uncomfortable procedures, especially something like tattoo removal. And it's actually quite funny because you'll see in my TikTok videos for tattoo removal, I do a lot of it. Oh, you're doing great. We're almost done. You know, take a big deep breath. You're doing such a good job. Like, I'm constantly talking through that, but there's a lot of positive reinforcement that comes from it. And I learned something through TikTok that I had not known before, and it's called a praise kink, where people love to hear positive things back, and it's like a reassuring and I guess, I don't know, good feeling type of thing. But anyways, I think that talk aesthesia is really very, very beneficial. And I have that added benefit of being a female kind of in that nurturing type of role whenever it comes to pain.
And I think I agree with what Loretta's saying, and I can, as a male, I can say it probably a little more bluntly. I wish I had Dr. Moore's male clientele, because mine are babies, and I'm one of them. So I'll be the first to say it. I mean, my men are definitely way worse when it comes to a pain tolerance and threshold than my females. But one of the things, you know, I think is important if you're, whether it's doing injectables or specifically like lasers. I know Loretta and I do a ton of lasers. You know, we're looking at devices that are painless. You know, there's painless laser hair removals out there. That's what I use. I know Dr. Moore was using M-Sculpt. I use the Physique, and that marries well into my male aesthetic patients. And the one thing I wanted to add is make sure too, like Loretta has an amazing TikTok presence and puts out great videos, as I think we all kind of have to be doing in this day and age. But make sure that you're including your male patients in your videos, because when you have male patients that are scrolling through your Instagram or your TikTok, they're going to identify with that. Oh, well, there's a male, and you know, they're enjoying the procedure. Even if you have to bribe your male to be like, all right, smile through this one, it's you're on camera. It does help. It makes a huge difference.
Thank you. Thank you. I do appreciate all three of you and your different perspectives. By the way, do any of you use Pronox, or any comments on Pronox?
We do use Pronox. I use it predominantly during liposuction, but with some of our RF microneedling and things like that, it gets used as well.
Yeah, I use Pronox, and I think it works really well as something to bring down the anxiety level associated with pain. It doesn't actually get rid of any of the pain. I liken it to maybe someone who is really drunk and falls down a set of stairs, and it still hurts, but they're kind of like, oh, that really freaking hurt. And so the anxiety associated with it is diminished. And I find it to be very helpful. We probably only have maybe 5 to 10% of people who elect to use it, because our procedures are fairly fast and our topical numbing works quite well. And then on occasion, if we have to do injectable lidocaine, it works well too. But if you need that little extra, the Pronox works really very well.
Thank you. Jordan, let's delve a little bit deeper into facial treatments for men. Can you talk about how Botox and fillers are used in your practice to achieve a more youthful look while maintaining that masculine appearance you touched on, during your first answer?
Yeah, absolutely. I'll kind of boil down just the basics because I think there's a lot. We could spend days talking about the masculinization of men using aesthetics. But just one example, you mentioned Botox. My approach with that is men are actually, in my opinion, a lot easier to treat with toxin because we have naturally lower lying brows to begin with, right? We have a heavier kind of look. Men don't like to be all lifted. Well, I don't want to say they don't. Some men do, but the majority of my male patients don't want to have that, snatched, frozen kind of look. And so I do a much softer approach with them. And I find that they're actually easier to treat. I always start a lower dose, and we know that men to achieve this same result as women tend to require a higher dose. And I think that's kind of been an issue in the industry because we're trained, or at least I was from the beginning, that men's muscles are larger, they're going to need a higher dose. But if you actually do that, especially for your first time male patients, they're not going to like that feeling. They don't like the heaviness. And so I really start slowly and we have that conversation. And a lot of times we'll just start with maybe a little bit of tox above that line of convergence and a little bit in the glabella, just so I can ease them in nice and slow so that they can get what I call, I don't know if anyone's read that Alex Hormozi book, bless you. He discusses kind of the giving them the small wins. And that's what I really try to focus on with my men is give them enough of a result that they are happy and that leaves them wanting more. It's much better to do that in a male client than to overdo it because you've lost them as a client if you over treat a male. More so I found than even a female. So that's kind of talks with filler. We can talk about jawline filler and the chin. That's really something I do a lot of. Men don't typically have that very defined, crisp V-shaped jaw. It's more of the widened U-shaped prominent jaw. So the injection techniques are going to be different. The product I use is typically different. We want to widen the jaw at the gonial angle, whereas with females, we're typically doing more of a posterior injection to kind of tighten and lift and define the jaw. So everything is just different with men, even the contour of cheeks. And so I think understanding, like I said, the male anatomy, if you can ever take like a male masculinization injectables course, you can learn a ton that way. And I really think that understanding the differences between the male and female is going to give providers and the anatomy a much better approach to how they're going to treat the men. And also, I'm mentioning products, but for men, we don't like to, and this goes for females too, a lot of times we don't want necessarily just filler. So for me in my practice, for my men, I'm almost at 70% Radiesse use, just because we're wanting more of that Hygie Prime and kind of chiseled look. In my opinion, it's a very forgiving product. And that's one of the different factors when I compare what I'm using on my female patients versus my male patients, how I dilute products in my men versus my women. Everything really is completely different with a few exceptions. But overall, just understanding their contour, their natural shape. But the other thing I really want to touch on is that I don't think we should follow algorithms. I don't think we should be doing this textbook approach, whether it's females or males. That's when we really start to have that kind of disfigurement or you're changing them. And men, the second you start to alter them to the point they look in the mirror and they say, oh, that's a huge difference. Normally, when men say, wow, that's a huge difference, it's not always a positive, right? So we want to make sure that we're maintaining their facial harmony, we're maintaining their facial structure, and we're not changing their appearance.
Thank you. Thank you, Jordan. Appreciate that. Loretta, can you talk about your consultation process in general and how have you tailored it or, added certain nuances to it to kind of cater to men? Because, one of the things that I'm really impressed is 35% of your patients are men and you are not a man, which is awesome, right? So like how how do you attract them? And I love the fact that you used the word babying and like, reinforcing and all these things you picked up, thanks to TikTok, thanks to wherever you picked up from. I mean, you're very creative and very innovative. So I'm just very curious to learn from you, and hopefully there's other people exactly in your shoes, and I'm sure they want to learn from you too.
Yeah, there's a psychology behind the consultation process for men versus women. When I'm talking to a male versus a woman, I have learned that men typically like for you to stand next to them versus standing in front of them when you're doing a consultation. They also prefer to be on the same level versus you standing versus them sitting. It makes them typically very uncomfortable. And so I will sit next to my men when I'm doing consultations, and I've got my PowerPoint and I'll go over it, versus a woman who likes to look me in the eye whenever I'm talking to them. I try not to take a confrontational approach or like, I know more than you, but have a little bit of a, let's work this out together, so that I'm getting their opinion on how to address them. And then I also find that men are quite decisive and they don't like to shop around. And so if you're giving them the information that they're looking for, they like to be right to the point, to understand and be very clear about the pricing. They usually, almost always, will purchase that day. And they want to get started. And I don't find that they hop around from place to place either. They just want to be consistent. So those are the things that I've learned as far as working with men. And then there are some key things that I like to say that I think will resonate with men too. Typically, men will get aesthetic services, not always necessarily to look better, but because they want to be more competitive in the workforce. And so I will focus on those type of things, especially if I know that it's a male who is a working professional. Women want to look youthful and beautiful. And so those are the keywords that I'll use with women. And I think those are some key points and differences between men and women, so that they feel like you're on their level and that you get them.
Makes sense. Ryan, let me ask you this. Wait a minute. Actually, before I go to Ryan, let me go back to Doctor. I'm going to ask this question of all three of you. So I'm going to ask the same question, and I'm going to ask Dr. Moore, Jordan, and Loretta. And let me start. I'm going to mix it up a little bit. So I'm going to start with Loretta this time. The majority of our registrants wanted to know how they could best market their services and attract male patients. What has worked for you at your practice? I guess, I think somebody shared stats. I think it was Ryan, right after COVID, the market grew 70%, and they're expecting it to go from like $1.something billion to 3.5. So there's a huge opportunity there. And the good news is not too many aesthetic practices are leaning in and going after the male patient. So there's a huge opportunity there. So from your perspective, what has worked best for you? So let me start with Loretta from a marketing perspective when it comes to attracting male patients.
Yeah, so my most effective marketing technique is actually the thing that costs me the least, which is social media. Our Instagram and our TikTok has brought in quite a few people, and it's authentic content that is really very short too. So it's really just a matter of somebody who is willing to film your content. Typically, we keep it at 30 to 60 seconds, and you show real people. And that, I believe, has been the most effective form of marketing. And trust me, we've done everything from radio to billboard, to print, to postcards, to magazines. And the most effective thing is showing authentic content on social media. That doesn't mean that we won't invest in everything else too, because you need to have it be well-rounded. And so we're very fortunate that I feel like we live in an era where most people are relatively comfortable with sharing their results. It's not like 20 years ago where everybody was kind of hush-hush with their Botox and whatnot. Generally, if you can maintain some sort of anonymity, maybe blocking out the eyes, or if it's just, a picture of a tattoo on the arm, most people are very comfortable with sharing their before and afters, and they kind of feel like, they're a little bit Insta famous when they're on your page. And so we have found that to be our best marketing technique, is showing our male patients.
Absolutely. It's kind of interesting you shared this. We work with 500 practices, healthcare practices, dermatology, med spa, plastic surgery, etc. And what I notice is 1% of my clients are who I call influencers, meaning they are the ones who have a lot of followers, and anytime they put a video, they get traction. Because just like SEO goes to the top 5%, what I found is free social media goes again to the top guys, the ones who have broken through and become influencers. And I can see, Loretta, you are passionate about this. You love it. I saw your TikTok and stuff. But most of the doctors don't tend to want to enjoy that. So I guess my question to you, a follow-up question is, I have one of my clients, she has 140,000 people following on TikTok and, 200,000 on Instagram. And one thing she told me is, you cannot outsource being a, influencer. You have to, like, in other words, Oprah can't hire somebody else to be Oprah. Oprah has to be Oprah. So I know you love it. You're very, awesome at this. But do you think if you don't love it, if you're not, if you are not naturally like interested in being this influencer, do you think it's a strategy that people should go after? I'm not saying it won't work for someone like you, but in general, like, because my experience has been slightly different when it comes to specifically social media.
I think people are looking for authentic content. And if you're someone who is like, I really don't like dancing on TikTok or Instagram, it makes me feel weird, but you end up doing it because your staff member encouraged you to do it, just comes across as awkward. And so if you find that social media is not your thing, then find what is your thing. I tell this to my staff all the time. You don't have to use social media if you're uncomfortable with it, because it's going to show. Market to your family, your church, your book club, whatever it is that is your group of people, and that feels natural to you, then that's where you need to be. And so I don't think that you should force it. I don't think that you can ignore social media. And so if you've got somebody young on your team that can help with that, then it's very beneficial. Once upon a time, we did outsource our social media, and it wasn't authentic. A lot of times the content was not even appropriate for our med spa. It would be related to a plastic surgery practice, which we are not. And of course, that person doesn't know that, because they're not in our practice every day. Yeah.
I totally echo everything you said. Yeah, I think if it's not for you, then don't do it just because everybody else is, right? I mean, this is true for everything in life. You shouldn't, even the people here, you shouldn't copy them unless it makes sense for you and that's you, because you have to find your own answers. Let me ask the same question of you, Jordan. Marketing, what works the best?
Yeah, so I agree with Loretta. Authenticity is huge. One of the things that I wanted to mention that has been really great is, and good for as a business owner, is take what you're already offering. Think of services you're already doing, and market it, and even rename it if you want. Think of a cool masculine name. So, for example, we do a lot of laser hair removal. Well, many men don't realize that you can outline a beard, so they're not having to shave their neck all the time. You can get rid of the neck hair, so they're not having to shave that and trim it. Make it like we called it the dapper package, right? So men are coming in and will use the laser hair removal device to clean up their beard, the back of their neck. The other thing I'm actually hosting this Sunday, we've never done this before, but we've already got over 100 registered attendees, is I have two passions, aesthetics, wellness, and to come together, and then cars. I'm a car guy. So we're hosting a car show. We have over 75 cars registered. It's going to be at our clinic, and it's free entry. So I'm going to have 100+ men right out front of my door on Sunday. And guess what we're going to do? We're going to be offering free HRT consults. We're going to be offering discounted blood draws, because if we can get them invested and we can show them, hey, you are deficient in your testosterone levels, or hey, look at all of these services that we have custom tailored to men, that's really going to be, I'm hoping, very beneficial. The key is getting them in your door, but before that happens, you have to let them know you exist and that there's services that you offer that they need. I think it's marketing 101, is that you have to present the problem for them to realize that there's a solution, and you are that solution. And so for men, it can be a very different way of going about it than maybe females. But I did, like I mentioned before, it's also getting the females involved. I can't tell you how many patients now, their husband got dragged in with their wives to get to sit and see Botox. And one thing I really stress, and I intentionally have very few chairs in my waiting room, is because we have a very comfy chair in every treatment room. And that's because I don't want husbands waiting in the lobby. I want husbands coming in, letting me talk to them while I'm doing the treatment, get to know them, build a relationship with them before they even become a client. And then before you know it, now they're a client. They're coming in for their Botox. They're coming in for, hyperhidrosis treatment. And you start with the small things and you establish the rapport and trust. And then they tell their friends at their pickleball match or their tennis tournament. And before you know it, you have men coming in left and right. And one thing that has been huge for us is hair restoration using PRP, PRF. I of all people know what it's like to go bald. I mean, I'm losing hair by the day. And so I can relate to these patients and say, hey, here's the things we offer. Here's the results you can expect. And they start with that. So, give them, again, that small win, educate them on what you offer, but also, again, marketing, making sure that you're showing men in your practice. Don't always highlight women, although it's still the majority of my practice are females. I make sure and I make it very intentional that I am, at least every time we do a content shoot, I'm including a male patient or two. And I can't tell you just from those few posts of men, how many men slide into the DM saying, hey, what was it so-and-so was getting? What does it do? How can I use, could I benefit from this? So I think those are really the key aspects for reaching the male audience.
Thank you. Dr. Moore, your comments, same question?
Yeah, I'm not a big social media person myself, getting up there in years. A lot of ours is through outreach to first responders, trying to establish business-to-business relationships. Somebody goes and buys a new car, they get a thank you gift from the car dealership, $200 to go into the Edge for Men or whatever. And it's a way of bringing people in that doesn't really cost you much. We also have referral reward programs where, let's say somebody's on our testosterone program, they refer a friend in, they get a month for free. And so ours is kind of directed in that regard. On the lifestyle center side, we use influencers, and the staff does a lot of social media and things like that. But over on the Edge side, we really run it more as a men's clinic. And so it's just run a little bit differently.
Fair enough. Thank you. Ryan, I skipped you last time, so I'm going to ask you a question this time. From a digital marketing perspective, you have worked with dozens and dozens of practice owners and helped them craft their strategy. What advice do you have when it comes to marketing services for male patients?
For sure. First, I want to say I'm very proudly being confirmed in this conversation that I fit into the typical men profile of impulsive, intimidated, competitive babies. So that's great. I feel really comfortable that that's been confirmed through this part, that all of them have come to fruition. But I think that's really a great question in terms of how to market, and from a digital standpoint, the strategies, and effectively reach this demographic. And again, we've heard it from Dr. Moore and from Loretta and from Jordan. It's that men and women, you have to be directed, you have to have a target audience. Even how, like Jordan said, the car show, and then Dr. Moore said, car dealerships, and we're talking about different ways. And he also mentioned the first responders and things like that. Like, go to where your audience is. That's where it's going to resonate. Make sure you're working on all of that. But when we talk about that, understanding your audience is doing that market research, understanding, the demographics, their preferences, their concerns, all of that sort of things. And Naren, you mentioned before, even things like the analytics from Google Analytics on that side of what are people searching for in your area. And it's not the same. And I've seen this again time and time again working with clients, that what people are searching in Miami Beach or in Tampa is different from Scottsdale. It's different from St. Louis. It's different from Fargo, North Dakota, and all that. Like, everything's got a unique strategy and a unique demographic. And I think we all know that. We can see that from number of different evidences of how there's different ways to treat different areas and things like that, and approach them. So we want to make sure we're focused on that. We've talked about the idea of highlighting the services, showcasing the treatments that are popular. Hair restoration, huge, right? Body sculpting, facial rejuvenation, skincare that's tailored to men, and really highlighting the benefits and the results of it. And as Jordan mentioned, we're not, it's going for the look that they're looking for, because there is still that stigma of, I don't want to look like, I'm getting windblown because that's how, or, whatever it is. No, you're going to look chiseled, as he said. You're going to look defined. It's going to be a different experience. So highlight those differences, use those videos and testimonials. Again, everybody here has talked about that, making sure you're showcasing real life experience with real life patients, and make sure that your male prospects can visualize undergoing those treatments. And that really builds a huge degree of trust. We talked about web pages for your website that has those blog posts, videos, infographics, targeted content. And when we talk about the importance of the website, social media, no doubt, amazing tool. You got to use it right. You've got to be there constantly, to Naren's point, things along those lines. You have to be comfortable, to Loretta's points, right? You got to make sure you've got all of that. But even if it's word of mouth, even if it's social media, even if they don't know who you are and they don't have no idea what to look for, to Jordan's point, you got to have everything laid out nicely for them to be able to find you. It's 2 steps. Number 1, are you being found? If you can't be found, nobody can choose you. I use this analogy a lot. Probably listeners have already heard me use it before. If you're the world's greatest artist, and I say, where are your paintings? Where are your sculptures? And they say, they're in my basement at home. I go, well, how am I supposed to know you're a good artist? How can I choose to buy your art and hang it on my walls? It's never going to happen. So you've got to be found first of all, and then you can go into building that trust and things like that. No matter where they're going to find you, how they're getting to you, they are absolutely going to use your website as a source of truth. Again, where is your photos? Where are your galleries? Where are those videos? Do you have a permanent? Where are the blogs? All of that, it is your source of truth. My wife can come home and say, hey, by the way, I've got this great restaurant. I know you better than anybody. I know you better than you know yourself. You have to try it. What's the first thing I do? I go to Google and I look it up. I trust her with my life, my kid's life, you name it. I still end up going to Google, and then Google ends up driving me to the website, and then the website gives me the answers that I'm looking for, right? So you've got to make sure that is, again, that's the journey that the aesthetics buyer is taking these days. So no matter how they find you, they are eventually very likely going to end up on your website. And over 90% of people who don't know who to use are going to start not by asking someone or anything else, especially male in aesthetics. There's still a little bit of stigma behind it. They're going to Google to get that information. So make sure you've got that optimized website content, relevant keywords, clearly navigatable, easy access to information for all of your male focused services. As you mentioned, on social media, make sure when you're making a video, you have a male patient. Share before and after photos, engage on social media with male clients that are on there as well. And I really love the idea of email marketing. That's your virtual dragging into the office, right? You have female patients that are receiving your newsletter on a monthly basis. Outline something in there. You know what's going to happen. They're going to get their attention and go, John, get down here. I got to show you something. Read this, right? And now all of a sudden she's engaged, even if he's not in the room there, even if he's never stepped foot in the practice. If he's the type that drops her off and comes back and picks her up and never leaves the car, there's still that level of her bringing forward, right? So use email marketing to your advantage. I love the idea of partnering with influencers and micro influencers and using that to increase your brand visibility and things along those lines. And then to Naren's point before with analytics, track and analyze your results. Monitor what you're doing for marketing efforts, using the analytical tools to show you, again, how many clicks are you getting? What's your traffic? Where are you ranking on Google? Are people converting from your website? Are they clicking to call? Are they booking appointments? All of those types of things. That's going to help you refine your strategy over time and capture bigger areas of the market that you didn't even know existed, or you could capture by making, again, a video, a blog, a new landing page, a web page, whatever it is that's going to come into to be able to play to your advantage.
Thank you, Ryan. Really appreciate your answer. Jordan, there is a question on Q&A specifically to you. So if you can answer it by typing in a question is, what male masculine sculpting course would you recommend? If you can type the answer, I'm going to go round robin and I'm going to, ask my final question to all of you. So I'll start with Dr. Moore. To anyone wanting to grow their practice with male patients, what's your final piece of advice? And also, if you're open to it, how can people get a hold of you? So Dr. Moore, I'll start with you.
For us, it was really bringing in hormone replacement therapy and treatment of ED, because it's a area of concern for men that's very specific, and then you can transition them over to your other services. So that's really how we've increased our male volume, is focusing on ED and testosterone optimization. More recently, weight loss as well, but initially those first two.
Thank you. Loretta, let me ask you the same questions. What's your final piece of advice and how can people get a hold of you?
Yeah, I agree with Dr. Moore. You need to find that gateway service to bring in that male aesthetic patient. And for us, that happens to be tattoo removal. You don't think of it as being a gateway type of service, but it really has been that service that has allowed us to transition people, male and female, males especially, into the other things that we offer. You develop a little bit of a relationship with people with tattoo removal, because it almost always is not a one and done type of service. It's something that happens over the course of 12, 18 months, sometimes 2 to 3 years. And you see people every 6 to 8 weeks. And so you develop a sense of trust, and it makes it really easy, especially for, a male who's like, I've always wondered about that Botox thing. Like, what does that do? Because now they trust you. And so find that gateway treatment. It may not be tattoo removal, but maybe it's muscle sculpting or hormone replacement or hair restoration, but it allows you to then move on to other things. To find me on social media, my business account is at Erasable Med Spa. That's for IG as well as for TikTok. And then I offer training for injectables and lasers at Aesthetic NP Life, and I typed that into the chat box too.
Perfect. Thank you.
Oh, let me say, if people need to get a hold of me, Dr. Moore at thelifestylecenter.com.
drmo@thelifestylecenter.com. We'll put it into the chat, or if you can type it in, Dr. Moore, that'll be awesome. So anybody can just copy paste it. Thank you for that. Jordan, same question.
Sure. So I guess, everything everyone else has said, the one thing that I did forget to mention that we do is, I think it's the opposite for men and women when they're coming in. So for men, we normally get the men through hormone replacement therapy, sexual wellness, sexual health. And then they tend to convert into the aesthetic side. Whereas with ladies and women, they normally come in for the aesthetic side and convert into the wellness and lifestyle side. One of the ways we do that, and we get a lot of weird looks at first, but I quickly explain why. We have an intake form. And on our intake form, it's your typical medical intake. It asks about medical history, allergies, all of the above. But then they come in for their Botox appointment, and then they're reading through that checklist, and they're probably wondering, why are you asking about vaginal dryness? Why are you asking about low libido? And then we have a male column. Do you have difficulty maintaining an erection? Do you have low libido? And what that's actually doing is it's creating a flag for us to then have that conversation. It opens the door for us to now talk about, I notice you check that, you're struggling with fatigue, difficulty losing weight. And it's the easiest way to do it because they've already checked the box for you. And it's a great segue into the wellness component for both men and women. So that's something that I forgot to mention that has been really successful in our practice in opening and starting that conversation. For getting in touch with me, the business account is urban_aesthetics_wellness. And then my just personal professional Instagram account is _Merce like male nurse, underscore the MERS injector, the underscore MERS underscore injector. And it's in the chat here as well.
Perfect. Ryan, same question to you.
Absolutely, yeah. So if you're looking to kind of assess what you're doing right now from a digital marketing, social media, you name it standpoint, or just have questions about how to start doing it and get a path for it, that's exactly what I do. In the chat, we'll put a link in there, but it's businessofesthetics.org/MSM. And basically, I create a platform for you where I review where you're at, what your competition looks like, what you can do differently, kind of what your current state is, and then we can discuss what that plan of attack is. Because again, everybody has, as we've heard around the table here, everybody's got different treatments they've got. Everybody's got a different system that they use. Everybody has a different way of intaking patients. Everyone's got their different, for lack of a better term, and sorry if it's crass, gateway drug that brings people in and then gets them hooked and gets them on to the next thing, right? So you need that custom strategy to kind of figure out what's going to work for you. I think that the information provided by the panel here tonight was absolutely exceptional, and the people are going to have a wealth of knowledge they didn't have an hour ago in how to improve this. But this is that kind of next step to say, great, take a look at what I'm doing now. Help me get those male patients in the door. Show me the strategy and show me the way. Show me a way to improve it based on what you know. And yeah, businessofesthetics.org/MSM, and we'll have a one-on-one, very granular conversation about your practice and how we can upscale it and get you moving faster to take a piece of that really quickly growing pie that's out there for the taking. So yeah, thanks, Naren.
Thank you, Ryan. And I do think the time you spend with Ryan would be well worth it. He spends a lot of hours researching and preparing for this so that you know where you stand when it comes to marketing, and and also he'll help you develop a strategy. I also want to take a minute to thank Dr. Mo, Jordan, and Loretta. You are all three like wealth of knowledge. I learned so much. And I think, again, I run a large company. We have 250 people. We can do a lot of things, but some things work and many things don't. And what I appreciate about this panel is we are cutting to the chase. We are talking about the things that work. Doesn't mean what worked for Loretta is going to work for you, or what worked for Dr. Mo is going to work for you, but at least you're getting real, direct, no BS, set of strategies that actually has worked for specific people. So of course, listen to it carefully. I would recommend go back and listen to it, because there's so much wisdom that came out. Literally every sentence, I felt like was something very useful. So listen to it again and then really think about it. If it makes sense to you, go apply it. You don't need to do 100 things to be successful. Hopefully you get 2 or 3 things from this event today and just focus on it and you stick with it. I think that's going to be the key to success. Thank you, everyone. If nobody has any final words, I would like to wrap it up. I know we are 5 minutes over, but I think we are pretty much on time.
Thank you for joining us this week on the Business of Aesthetic podcast series brought to you by our gold sponsor, Equa Marketing. Would you like to join our growing group of aesthetic industry experts and get featured on the Business of Aesthetics podcast? Or do you know someone who would love to share their strategies for growth in the aesthetic business, providing quality patient care or their clinical expertise? Head over to www.businessofesthetics.org/podcast show and apply to be featured as a guest on the show. Remember to subscribe to this podcast on iTunes, Amazon Music, or wherever you listen. If you would like to engage with today's speakers or any of our past speakers, join our Facebook group or LinkedIn group by searching for Business of Aesthetics. Thank you and have a great day.